Treasury has planned cuts ahead of the medium-term budget, which is set to be delivered next month by Finance Minister Enoch Godongwana. The Health Department and activists have raised concerns over the impact of these budget cuts. Health Minister Dr. Joe Phaahla says his department could see a reduction of over R1 billion, which may affect, among others, HIV and AIDS healthcare and treatment. Let's unpack the story for you. Budget researcher at Section 27, Matshidiso Lencoasa, joined us in studio. It's great to see you. Thanks for coming on.
Thanks for having me.
It's such an ironic story, right? Because I was just reading a story this morning in the Business Day. It was reporting on what the UN had to say, and this was back in July, around the fact that the world can end HIV and AIDS as a public health concern by 2030, but only if governments step up spending.
Exactly. And we were having this conversation earlier today about similar things around HIV access, is that there's been a lot of work over the past decade or so about, in terms of HIV activism, ensuring that as many people get access to ARV antiretroviral treatment so that we meet the 90-90-90 goals as stipulated by the UN. However, with these budget cuts or these there are concerns that there are constraints to the resources to be able to achieve that. Yeah. It might mean that we might actually regress and go back to some of the more difficult times pre-pandemic when, you know, the HIV was, and I mean, it still is an epidemic in the country. We still have the highest number of people in the world that are HIV positive, and I think, you know, there are gender implications to that because while it affects everyone in the country, the risk and the prevalence of HIV/AIDS is disproportionately among young black women, so it's our demographic who's most affected by this. Yeah.
So you talk about having the highest HIV and AIDS burden right here in South Africa. Yeah. In terms of new infections, how do we fare with the rest of the world, and how does this decision on budget cuts impact that?
Yeah, so I think even 2 days ago, the minister had had been asked a similar question about and raised that it is concerning the new infections, especially post-COVID pandemic. However, with these budget cuts, you know, fiscal policy is a powerful intervention to reducing something like that, including drives towards public education, access to ARTs, but also to other innovations like PrEP treatment, PEP, that sort of access, but with and also access to testing. But when you cut the budget significantly, we already have a public healthcare system that is under-resourced and that is understaffed. And so it just means that the little that we have, we spread those resources quite thinly, and so there are people who are left behind. Unfortunately, it's the most underserviced communities in the country and the most underserviced demographics who are left behind by this.
I'm not sure if you would have researched this angle, Matshidiso, but there's a lot of analysis around the irony of cutting spending in a context because we're cutting spending to try and rein in our own spending as government, right? Because we are struggling as a country financially. But the irony of cutting spending when we could actually boost our own GDP if we meet our funding targets for HIV and AIDS.
It's true. And even organizations like the IMF, which have been long criticized for their propensity to austerity, have recognized that HIV/AIDS is actually a deterrent and a threat to economic growth.
Right.
So it is actually quite interesting that we respond to economic growth by cutting spending. We want a healthy population to participate meaningfully in the economy, to grow the economy, among other things, including, human rights is a very important part, but even the argument of economic growth, you need healthy people and, people who are alive and life expectancy. It's very much economically beneficial as well. So it is true that it doesn't correlate. And also over the past decade, government has been criticized for the cuts to spending. So yes, there have been increased allocations, but they've been increasing at a decreasing rate, so below inflation. So this year, for instance, the health budget was cut in real terms by 4.9%. And so we already find, these cost containment measures and these budget cuts already find the healthcare system under-resourced and already critiqued for that. So it's just quite ironic that the response to this is the response to the impact of fiscal consolidation that hasn't really been working is to cut budgets even further. It just doesn't make sense.
So in terms of what activist organizations are doing now, I mean, is there a conversation that can be had with government to say, okay, we understand that we need to cut budgets, that the health department needs to cut budgets, but can we divert the money from elsewhere and leave HIV and AIDS untouched?
Agreed. We agree with that, and that's a large part of our advocacy is, one of the areas what we found really interesting is that these cost containment measures, state-owned entities were actually exempt from them. So it's looking at areas like basic education and healthcare. And so in the same way, we call on government, among other things, including considering fiscal expansion side, but on the more expenditure side is to be thinking about human rights impact assessments and how we can protect healthcare, education, particularly HIV, AIDS, TB, funding as essential services that are protected from that. And so when we look at that, we should be looking at how do we improve the quality of spend to ensure that the service delivery, the money that we use actually does translate into adequate access to quality healthcare services, rather than the first reaction being to cut the budget.
Yeah, it makes sense. You mentioned this a little earlier, the fact that women and girls are disproportionately impacted by HIV and AIDS. It makes sense then that we will also be disproportionately impacted by these budget cuts, just for the mere fact that we rely on healthcare services much more, statistically speaking, right?
That's true. So while budget cuts impact the whole country, everyone is affected, and we've already experienced that. We're hearing conversations and reports on the ground about this. These impacts are disproportionately borne by women for a number of reasons. We still live in a very unequal society where the care work, the burden of care work is disproportionately carried by women. It is women who typically look after sick family members, who take children to hospitals, and it's also at the ground level, the nurses that we have, over 90% of nurses and community healthcare workers are actually women. So it is women. When austerity measures or budget cuts, cost containment measures in this case, occur, it is women who mask the impact with our unpaid care work, and it reduces our ability to participate more meaningfully in the economy because we're busy making up for the support that we're not getting. And then, of course, HIV, AIDS, as we mentioned, the impact is disproportionately among women, like young black women specifically.
Of course, we wouldn't be having this conversation if we were able to rein in an issue like corruption, which we know loses an incredible amount of money insofar as the ability of various government departments to deliver services.
Absolutely. And wasteful expenditure, corruption, those are real threats to the realization of rights, of healthcare accesses. And things like consequence management, all these interventions, those are over the past decade, those are areas that I think should have been focused more on, and we should continue to think about how do we rein that in, because, healthcare provision is a very complex system, and it's a life or death situation, and it impacts so many people, and we do need, and in the same way that because women depend more on the healthcare system, the corruption also has implications for gender equity and meeting our gender targets, because women are the ones who have to mask that corruption, and there's also reports of sexploitation in all these other things. So, corruption is a huge threat to the realization of human rights, and fiscal policy can be a powerful way and the budget to redress that. Yeah,
absolutely. Let's hope it's still a discussion that is open to changing the way that we do decide to cut our budgets. Matshidiso Lencoasa is a budget researcher at Section 27, and we're discussing Treasury's planned cuts ahead of the medium-term budget, which is scheduled for next month.